sorry today we kept too long to go on live. So I want to share something very important to you once again. So I have an article which was written by one of the doctors, and I feel like it's something very interesting I would like to share with all of us. So I'm going to read what the article is, but don't forget to share this video to your loved ones and friends. So kindly share this video and we get a lot of people to react. So this article is very interesting, and so that's what I'm going to read here. All right, so we just pay rapt attention. This article was actually released on the 12th of August, and so I will leave the description, and I will leave the link in the description so you can go and read about this. All right, so please don't forget to share these videos to your loved ones and friends. Okay, so let's continue. So I'm going to read the article here so that we can all learn together. So the title of the article, this article is from Health and Best Tips, and it was written by Dr. Roland Badu. So I'm going to read it and share the link to you. The title of this article is, Can Probiotics Cause Constipation? And he added the latest evidence. So I'm going to read what is here. All right, so please share this video to your loved ones and friends. Yes, so he has in the article, the question he asks, can probiotics cause constipation? So probably, but it appears to be uncommon, and the evidence for probiotic directly causing constipation is surprisingly thin. This is one of the most questions where a simple yes or no answer can be misleading. So that was what the writer is saying. Okay, so if you are joining me for the first time or you are just new with the live, I'm actually reading an article that was written by a doctor, which is called Dr. Badu Roland, and I will leave the link in the description after this video where you can follow the reading. So this was an article written by Dr. Badu Roland, and it was asking a question about probiotics causing constipation. And so I want to, it's a very interesting article, and I think I would like to share this with you. So the first point he made was that the answer is not a yes or no. All right, so he wants to go into it for us to really understand what is really going on. And so that's why I'm reading this article, for us to dissect it and have a fair understanding of what is going on there. All right, but you can also ask your questions in the comment section and leave shout outs to, and I'll read it. All right. So he went on to say that if someone starts a probiotic on Monday and becomes constipated later that week, it is perfectly reasonable to wonder whether the supplement, the probiotic is actually a supplement, whether the supplement is responsible. And I think this is a very valid question, because most of the times, okay, so most of the times there are some medications probably you would take, okay, and then when you take those medications, you realize that maybe after a day or two, or maybe 3 days later, you realize that there are some other symptoms you begin to develop. Now the question now remains, is that symptoms that you developed as a result of the medication, or the symptoms you are having is actually another new disease or infection that you are having? I don't know if you get a picture. Exactly. So sometimes the overlay of new disease or new infection with an existing old infection you're treating with some medications can become very confusing. Yes, can become very confusing. Now, so the writer was asking a very important question, that if someone takes a probiotic, let's say Monday, today's Sunday, so let's say Sunday, he took the probiotic, which is a supplement, and then a week later, he then developed constipation. Can we go on to say that is the supplement that he took that's what caused the constipation? And that's a very important question. So let's continue. He added by saying that, but the fact that one event happened after another does not establish the causality or the causation. And it's true. Okay, so let's say someone is sick of what should we use? Abdominal pain. Okay, and they gave the person some pain medications in quotes. Then a day or two, 3 days later, the person is now having, maybe probably is taking the medications, okay, is now having headaches. Do we say that because of he or she taking the pain medications and is having headache, meaning that the pain medications what cause the headaches? No, you see, so you can't really establish the causation of the headache just because the person is taking that medication. So that's the point the writer was reading. So guys, welcome to OPG Hub. As I said, I'm reading an article that was written by one wonderful doctor, Dr. Badu Roland, and I feel like when I read the article, it was very interesting, and I think I want to share it with you guys. At the end of this video, I'll leave the description. I'll leave the link in the description so you can also read the article for yourself. The article is from Health and Best Tips, and I think it's a very wonderful concept of writing. Yeah. So let me see in the comment section. Tell me where you are watching me from, and share this video to your loved ones and friends so we can all learn together. It's very important. So then he went on to say, so what the article I'm reading is called Can Probiotic Cause Constipation? Okay. He went on to say that that distinction is particularly important with probiotics because probiotic is not one treatment. Different products contains different microorganisms, strains and combinations and dose. Now, so what he's trying to say that this probiotic, like the way we have antibiotics, you know, probiotics is not one particular treatment. It's actually a combination of other products. That's what he's trying to say, that if the person is taking this particular supplement, okay, if the person is taking that particular supplement, this supplement is not actually one treatment. It contains different um, organisms. And so the probiotic, they use organisms to do it. And these organisms that they use the their strains, their combination and their doses. And then he went on to say very importantly that the American Gastroenterological Association. Now, this association is very important when it comes to regulation and also scientific research, evidence by what they do. So this probiotic, it says that the American Gastroenterological Association has specifically emphasized that probiotic evidence needs to be considered according to the individual strain or formulation rather than treating all probiotics as interchangeably. Now, so what this article is saying is that with the probiotics, okay, the American Gastroenterological Association is saying that yes, probiotics is good. We know probiotics comes with varieties of, they use microorganisms, their strains, their different strains, parts of their stuff to form the dose and then the combination of the medication that they are going to give, the supplement actually. But one very important thing they have found is that all these probiotics are suited for individual base. Okay, so rather than treating all probiotics like, oh, if I'm taking probiotic A, meaning that in the general population, probiotic A is suitable for all of them. Do you get it? But he says that no, that is not the case. this probiotic, it's actually a formulation for individuals. Do you get it? So that's where it becomes more interesting. Then he went on to ask a very important question. He went on to ask a very important question. So let me see if I can. Um, Please don't go and share this video to your loved ones. All right, I want to write something very important, and then I'll come back to you. Okay? Yeah. So just stay on. Don't go. All right. So this is very important. I can't really see your faces, but then let me keep it here. Okay. So I think I can come back a little bit so I can talk about it. All right. Sure. So let's continue with what I was talking about. So there was a lot of research that has been done about this probiotic, and I would like to read for you to know. And this is a very interesting article, guys. It's a very interesting article. So what research says about probiotics is that a person can experience constipation while taking a probiotic, but current evidence does not support describing constipation as a common side effect of probiotics. So that is what this research is saying. So we want to find out whether is it when I take some supplements and then I develop constipation, um, is it because the supplement caused the constipation or otherwise? So that's what the research is trying to address, which is saying that it is not true. Are we together? Good. So let's read what more for this. It says that there is an interesting reason for that conclusion. Yeah, so these are interesting reasons. If probiotics commonly caused constipation, we will expect clinical trials to show more constipation among people taking them consistently. and and this is a very good argument. Okay, this is a very good argument. It says that if you can confidently say that taking this supplement or taking that supplement will cause constipation, then we must have seen it evidenced in people. A lot of people who are taking the supplement for quite a number of time, for us to make the conclusion that okay, when you take this probiotic, especially let's for the purpose of our discussion, let's keep the probiotics as probiotics OPJ. So for us to come to the conclusion that when you take probiotics OPJ, you are going to get constipation, it should be quite a number of people taking probiotics OPJ who have had constipation for quite a number of time. Then we can make the conclusion that when you take probiotic OPJ, you get constipation. Do you get it? Uh, but you can't just say that, oh, I took probiotic OPJ and this individual has constipation, that person did not have constipation, and then just conclude that when you take OPJ, when you take probiotic OPJ, you get constipation. So that's the argument the research made. We say that you can you need to expect there should be a clinical trial to show that more people are having constipation anytime they take the probiotics. You get it? Then he went on to say very importantly, so looking at various research previously done, probiotics have repeatedly been investigated as potential treatment for constipation rather than causing constipation. So, what this writer is saying is that there have been a lot of research that has been done, a lot of research that has been done, quite a lot, which all support the fact that probiotics does not actually cause constipation. However, it rather prevents constipation, or rather a potential treatment for constipation, according to what the writer said here. Are we together? Excellent. So let's move on. This is a very interesting stuff, and I would like you to have a clinical reasoning anytime um, we are reading this, so that you can appreciate what goes into this writing. Okay, so this is a medical doctor writing, and I'm reading from it, and you can see that he's actually making some very important points, very important clinical reasoning, and that's what I want you to picture from. All right, so you need to have a clinical trial for you to say that this medicine can cause someone to have constipation. However, the evidence or the research has shown that rather it does not cause constipation, but it's a potential treatment for constipation. So there are a lot of times someone thinks, so they, like I want to show something to you right now. Okay. Now I don't know if you know minoxidil was actually used. The initial purpose of minoxidil was not for hair growth. Okay, it was something differently. All right, but then after a while, they realized that it was making hair growth. Like when you smell it, it gives them hair. Okay, the side effect of the medication was actually hair growth, and so now they don't even use that medication necessarily for that intended purpose, but rather for the side effect, which is the hair growth. So, so the point I'm making is that there are some medications that their side effects may be beneficial, okay, for other treatment of other condition. Okay. Uh-huh. Basically, that's what I'm trying to say. There are some medications, their side effects are used for the treatment of other conditions, and it has been shown evidently that this is very important for the management of that particular condition. And so that's like a good news. It's like a sudden finding, and that has been a blessing to that condition. Okay. Now, with that said, with probiotics, what probiotics is doing is that its intended purpose was not for treating constipation. However, clinical trials shows that its implementation or its usage has drastic in improving constipation. Do you get it? So, okay. Now let's continue again. I think you are really following the clinical reasoning with this condition. Attachment with what he wrote. He says that, so I'll leave the, the article, the link of the article in my description, so you can all go and watch it out, okay, and read about it. It's a very interesting stuff. But then I have a question up here. Have you heard about probiotics? You can keep your answers to me, yes or no. All right. So looking at previous research previously done, probiotics have repeatedly been investigated as a potential treatment for constipation rather than causing constipation. The probiotic, I will list quite and here is a systematic review and a meta-analysis of 14 randomized controlled trials involving 1,182 adults. So this study just took two people, three people, and they heard from them, oh, when you took the probiotics, the supplement, did you get constipation? Did you treat constipation? Yes, no. Then they say, oh, probiotics. No, 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 no. That was not what happened. He said that they use 1,182 adults, okay, who were actually having constipation. So, what the writer is saying, according to the writer, he's saying that 1,182 individuals who were actually having constipation, actually, they did a randomized control trial, and the probiotics actually caused them to have free bowel, which reduces their time to have bowel and it reduces their constipation. So, so probiotics actually had a potential treatment or potential benefit of, you know, kind of benefit of, you know, kind of reducing their bowel um, duration gut or improving or easing the gut. So, in other words, to avoid constipation. So basically, that's what they are trying to say. Okay, so let's continue. Thank you so much for joining in. I really appreciate you. Yeah, I don't take it for granted. Okay, so that is it. That's a very interesting article. Now let's move on. The article it will end very soon, but it's a very wonderful article. It says that then again, this article was not just like that. This one was by Demidi, but another article by Miller also said that a systemic review of 21 studies involving 2,656 adults with constipation also found an interesting, and then this was an interesting fact, an increase in weekly stool frequencies with probiotics containing products. Although the study shows substantial heterogeneity and evidence of publication bias. Okay, so what this person is also saying is that the study conducted, they took quite 21 studies around these probiotics, and these 21 studies around these probiotics captured about 2,656 individuals, and they realized that yes, the probiotics actually helped in constipation. It's a potential treatment for constipation. It reduces the long time for people to have passes through. Okay, so that's basically what this study showed. So it's actually improved. So anytime they took the probiotics or probiotic products, and this probiotic I'm talking about is like a supplement. Okay, so you get to know those probiotics. So when you go to the market and you hear, I believe you have heard about antibiotics. Yes, we also have something called probiotics, and that's what I'm talking about. I'm not talking about antibiotics necessarily. I'm talking about probiotics. All right. So the question is up there. Have you heard about probiotics? Yes or no? Kindly let me know your vote. So this is a referendum. Answer yes or no. Okay, sure. So it went on to say that all these studies showed that probiotics cannot cause constipation, but it rather tells us something very important. And what is that something very important? Clinical research has more often investigated certain probiotics as potential treatments for constipation than as a cause of a new onset constipation. And that is true. That is basically true. So, and for us to make a conclusion, we need to have data, we need to have scientific facts to back it, and that is what the scientific studies have shown. All right, great. So please, if you are new here, you are just joining me, kindly drop a my good friend. Shout out, shout out, shout out. Just say, let me see. Let me give you hello. Okay. Okay. Now, another very important question in the article says, how soon can probiotic cause constipation? Okay. And that is what I'm going to read. These are very interesting. Probably I will end it somewhere, and then tomorrow, hopefully tomorrow, we can continue. But stay true and don't leave. Don't leave, okay? Okay. It's a very wonderful article. I know you want to. So it says that how soon can probiotics cause constipation? One question that often follows is that can probiotics cause constipation? And if it's, how soon will it happen? So I'm going to read. It says that unfortunately, clinical research does not give us a reliable answer, such as within, let's say, 3 days or a week or 2 weeks, that these probiotics will cause constipation. However, studies studies of the probiotics have generally not been designed to establish a specific onset period for the probiotic induced constipation. All right. Uh-huh. Yeah. Therefore, if constipation begins a few days after starting a probiotic, the timing is worth noting. But, okay, so the timing is worth noting, but what do you think it would be? I've already made it, the clinical reasoning with what I just said. The timing is worth knowing because it may not be from the probiotics, right? But rather from a different thing. And don't forget, I said that the probiotics actually helps with the constipation. So if the probiotics is helping with the constipation and you are actually having a constipation, then that means that the cause may be from a different route. Are we together? Okay, please don't forget to share this video with your loved ones and friends. Let's all get together. Okay. So I hope you have learned something today. I'll share the video in the link in the description so you can all go and read it. All right. Thank you so much for joining. I really appreciate all of you for joining. All right. Oh, share this video. I'm trying to read it on for you. Okay, so thank you. At this point is where I want to end it today. I hope you have learned something today. Don't forget to share with me what you have learned. You can drop it in the comment section. Let me know what you have learned. Okay.
J'ai 55 ans et aujourd'hui je passe de la salle de sport à la marche tai chi. C'est moi après 28 jours. Ma robe d'il y a 4 ans.
Okay. So thank you guys so much, and I wish you the very best for joining. Hopefully, God willing, tomorrow we go on live again. Don't forget early morning dose. So tomorrow, God willing, we'll be doing our morning dose. Okay, we are going to talk about everything else. So stay tuned. for tomorrow morning, where we're going to talk everything health for the week. And I wish you the very best in the week. And very importantly, I also want to thank you guys so much for joining the live anytime you go on live. I don't take it for granted. Look at the time, and you're still here. God bless you. Merci beaucoup. Aujourd'hui, uh, how did they say it? God bless you, cry in French. Anyway, Nyamin Shramo, Maune Yiram, something like that. And what else? Let me see. Ga, Mona Drum. Uh, uh, what else? I think the languages are not coming. When I remember some of them, I'll share with you. But I want to thank you so much. And so this is our channel, OPJ Hub. Don't forget to subscribe to this channel where we share everything health. And I am strongly sure that our videos are blessing you. So don't forget to subscribe to this channel. Watch our videos. Our videos are very amazing. They are nice. We break our videos down for you to understand, have a very important perspective on you appreciating your health. So on this note, hello everyone, my name is Dr. OPJ Hub, and I'm specially asking you to subscribe to this channel for more health content so you can make informed and life-changing decisions about your health, so you and I can stay healthy. Okay, I know you are doing that. And don't forget to share this video to your loved ones and friends. Okay, thank you so much. I want to know that person. Can you drop something in the comment section? Let me know that you are with me. Okay.